Hi, my name is Kiera. I am a P1 at the School of Pharmacy for the University of Charleston. Today we will be interviewing Mr. David Bowyer. He is the chair of the Department of Pharmacy Practice here at UC School of Pharmacy. He has many achievements, including being a practicing pharmacist for over 30 years. He has several publications, and he was also granted the title Fellow for the American Society of Health System Pharmacy. So,
Thank you for that wonderful introduction.
you're welcome. How are you doing today?
Doing pretty good.
That's good.
Yes, it is.
So
We're stuck in here.
Yeah, well, I mean, it's okay. So why did you choose pharmacy as a career?
Well, in all honesty, I started out as looking at medical school, as several pharmacists do. And when I was an undergraduate, I was working in a hospital. And I got to see doctors and how they reacted to patients and things like that. And it really I didn't really like it that much. And so I started looking at other things in the healthcare profession. I looked at medical technology, I looked at nursing, I looked at a couple of different things, and I kept coming back to pharmacy. It kind of fit my personality. I knew my pharmacist. I grew up in a small town, and one local independent pharmacist that everybody knew. And actually, his son and I graduated pharmacy school together, or graduated high school together.
Oh, wow.
And so, I'd been in his store a lot, and just the more I looked and researched after I decided not to go to medical school, pharmacy just seemed to be the right fit for me.
Wow, that is a very detailed explanation.
When you ask.
Yes. So what exactly was your career path, what you decided pharmacy was your best pick?
Well, when I came out of pharmacy school, I wanted to own my own store. And I went to work, as most pharmacy graduates do, I went to work for a chain. And I worked there for 3 or 4 years, and we came back to West Virginia. And I had an opportunity to go to work for a gentleman who owned an independent pharmacy. He actually owned 2 stores, one in Ripley, West Virginia, where I'm from, and the other one in Ravenswood, West Virginia, which is a little small town about 10 miles north of there. During that time, I was able to manage the store. I was able to see, and I was able to learn a lot from him about independent pharmacy. And I discovered that it was very hard work. And sometimes you are the last person that gets paid. And if you have to pay all the technicians and, insurance checks don't come in or something like that, you wind up, not getting paid. Now, don't get me wrong, there's a lot of very successful independent pharmacists, but it's hard. And I didn't really want to work that much.
Yeah.
I had a family, and I wanted to spend time with my daughter, and I wanted to, watch her grow up. And what I saw from a lot of independent pharmacists is they missed a lot of that growing up. They missed a lot of their kids growing up because they were working a lot. We were open, 363 days a year. So, and like I said, it kind of changed me from wanting to open my own pharmacy to, well, I'm not sure I want to do that. So I looked around, once again, and saw what was available, and I was fortunate in that the local hospital in Jackson County was looking for a pharmacist. And actually, one of my technicians who had left my store, went to work at the hospital, called me and said that there's a job in the hospital, and would you be interested in coming? Well, you all will learn that in my past experience in hospital pharmacies, everything was in the basement, and you never saw the light of day.
Yep.
And so, but this pharmacy was on the first floor, had a nice view, had a nice window like this, was able to see out. The pharmacy was only open from 8 in the morning till 6 in the evening. So I had my evenings, I was able to do things, and go watch my daughter play softball and play different sports and things like that. So I decided to go into hospital pharmacy, and it was a life-changing experience for me. So that kind of took me from hospital pharmacy into more looking at academia as a career, and kind of provided some background from the job I have today. Really, as a department chair, I manage people, and that's what you do as a pharmacy director, is you manage people.
So it seems like you have a pretty broad, I guess you could say, understanding of the different areas of pharmacy. So what were some of the pros and cons of working in each of the industry, the academia, and the hospital pharmacy?
Well, I told you I told you about independent pharmacy, how hard it is. Now, independent pharmacy on the pro side is very gratifying. You get to know your patients very well, and it's very gratifying when they come and ask for you. Like times whenever you have somebody who works relief for you, and the patients come in and they see you're not there, and they tell the techs or they tell the clerk, well, I'll come back tomorrow. That's very gratifying, and thank you cards that you get, and Christmas cards that you get, and brownies that you get, things like that are all very gratifying. You become part of their family. You become their healthcare provider, more so, I think, than in chain pharmacy. Now, you can do the same thing in chain pharmacy, but chain pharmacies typically are a lot busier. You have a pharmacy partner. Sometimes you have 2 or 3 pharmacists, and people don't build that connection as much as they do in independent pharmacy. And I'll give you a little hint for my lecture on Monday. In hospital pharmacy, it's a lot the same thing, particularly in a small hospital pharmacy, because the patients you have on the outpatient side, you see them on the inpatient side, and a lot of times they are they come in repeatedly during the course of the year. If you have somebody with congestive heart failure, they may be in the hospital 8-10 times a year. The difference is in the hospital pharmacy, you see them get better. In community pharmacy, you maintain their health, but in hospital pharmacy, you help them get better. And that's always been the big difference for me. Now, as far as academia goes, I always precepted students when I was working in the hospital, and I saw being experiential director, which is what I was before department choice, but I came into academia as a natural extension of that. I was pretty good at teaching students one-on-one. Some of you will say not so good at teaching students 56-1, but that's everybody's personal opinion.
Yeah.
But you didn't have to agree, by the way.
Well, I can understand how that would be a little bit challenging.
But being able to, and what I saw whenever I precepted students, I saw those students go on to become successful pharmacists. And I figured if I did that with a handful of students that I took as a preceptor, and saw how gratifying that was to see them, have their own store or work at another hospital or things like that. If I could do that for 50, 60, 70 students a year, that would be even more gratifying, and it has been. Whenever I see students graduate, especially whenever I see them get jobs and go out and become successful graduates, that's very gratifying to me. That's kind of, like I said, that's kind of how I got, over 30 years, got to here.
So what were some of the cons about
Hospital pharmacy, some of the cons, once again, you're ruining my lecture for Monday, but people will be watching this after the lecture, so some of the cons is it's very stressful. Especially in small hospitals, rural hospitals, a lot of times money is very tight. You have to watch every penny, and you have to transfer patients that you can take care of, so they can get more intense care. You also you're usually a lot of times the only pharmacist, so you don't have anybody to bounce ideas off of. You spend a lot of time on the phone, and like I said, it's very stressful in community, especially in small hospitals. Community hospital can be stressful, but not really that much, because like I said, you're not dealing with life and death matters on a day-to-day basis. Like I said, you can be in community pharmacy, but normally it's maintaining patients' health, giving them their meds for blood pressure, things like that. When you're dealing with patients who have just had a major heart attack, and you're trying to make sure that they keep their blood pressure up and give them the right antibiotics, give them the right medication, that's very stressful, and it wears on you after a while. You also have call in the hospital. Like I said, we were only open from 8 to 6, but I was on call 24 hours a day, so that got to wear on you after a while. Stresses in academia, dealing with student issues. I've been able to build in this department. I've been able to build a very good group of faculty, a very dedicated group of faculty, and a very intelligent group of faculty. And they really don't. I don't have a whole lot of problems with them at all. And I don't mean to denigrate the students. I don't really have a lot of problems with the students, but sometimes you have student issues that rise up, and it could be a conflict between a faculty member and a student or something like that. The other constant as far as pharmacy goes is usually you are middle management. In hospital, you're middle management. You have to answer to administrator. In chain pharmacy, you have to answer to a district manager. In academia, you have to answer to the dean. And sometimes that causes a lot of conflict. So it's much easier sometimes to manage down than it is to manage up.
So you had mentioned, well, I had mentioned that you had worked in, or you have several publications. What is your most, the achievement that you have? What is your most fondest achievement?
I mean, as far as publications or any of the awards I won?
Well, what are you most proud of in your achievements? Working as a pharmacist, your publications, your
Well,
fellow title.
And I would have to say what I'm most proud of is things like thank you cards that I got. I was working at Kroger's one time, and I remember very vividly a mom came in on Sunday morning. I was the only pharmacist, didn't even have a tech working there. She had this prescription that had an error in it, or had a question about it. And so I just told her, I said, I have to call back. She'd come from the emergency room. I had to call back out of the emergency room, get the prescription clarified. It's something we do every day, and we don't really think about it and how it impacts our patients. But 3 days later, it was for her child, which adds another layer to it. And 3 or 4 days later, I get this card in the mail. It's a thank you card from her, thanking me for taking care of her daughter. And that, to me, is probably the most gratifying thing I've gotten. Now, I've gotten a lot of awards over the years, including being awarded fellow status, which is great. Don't get me wrong, that was very humbling to me. But things like that, thank you cards from parents, or thank you cards from patients, or thank you cards from students. I've gotten several cards from students thanking me for writing a recommendation letter, or things like that. Those things are always very more gratifying because it's a personal level, and they take the time to do it. Everybody's very busy, and when somebody takes the time to sit down and write an old-fashioned thank you card, it's very gratifying to me.
So the very sentimental things that make you realize this is why I'm a pharmacist.
Yeah, because it's all about patients, and it's all about taking care of the patients. And like I said, sometimes we get so bogged down in cranking them out, doing the numbers, that you forget sometimes that there's a patient at the end of that number.
That's very true. So, on a little less serious note, what do you like to do in your free time?
Well, I have a boat, and I keep it just down the river from here, and I will call them up, 4 o'clock in the afternoon. I love to do that today, but I'll be traveling this afternoon. But I'll call them up and say, put the boat in the water, and my wife and I will go out, and we'll just kind of sit and not really do anything. We'll just sit there and maybe read the paper, maybe listen to music, things like that, just relax. The other thing I like to do is play golf. I try and play, I don't play as much as I like, but I try and play maybe a couple times a month, something like that. Other than that, working around the house. I like jobs where you have a defined ending, like mowing grass. You look out at the lawn after it's cut, you see it's nice and looks good, things like that. You take some personal satisfaction in that.
So some outdoorsy, do any fishing? So what matters to you most in terms of personal attributes of a good pharmacist?
Caring for your patients, okay? That's number one. You have to realize that the patients come first. If it's 9 o'clock at night and you work a 12-hour shift and you just want to go home and somebody walks in with 6 prescriptions, you fill those 6 prescriptions. You don't tell them to come back tomorrow because they need those prescriptions that night. The other thing is I want to see people who are passionate about the profession, who realize that it is a profession and not a job. I try and instill that in you guys in class a little bit, that you have additional responsibilities because you have additional rights, and that's what separates a profession from a job. So I really like to see that, and I know a lot of wonderful pharmacists who that's the 2 common traits that I see. Number 1, they put their patients first, and number 2, they hold the profession, they respect the profession, and that's the 2 main things I try and hold to.
It means a lot to us that you're putting in all this time and effort. Well, I want to thank you for letting us interview you today.
Well, thank you. I appreciate that.